Just going to take time and let some other folks in here. Good to see everyone. Hi, Keisha.
Hello, hello, hello.
I love it.
That'll wake us up if we want.
Uh-huh.
Yeah, I love that too. Thank you for that, Keisha.
You're welcome.
All right, it's 12 o'clock. I'll give folks about another minute and we'll get started.
I love the colors you have on today. Nice.
Yeah, I'm trying to just help Summer hang around a little bit. It's working.
I know, honey. Stretch it out, stretch it out, stretch it out.
It's working. We got some weather ahead.
It looks like Vanya and Vanessa talked to each other this morning.
Yep, we're just channeling the inner sunshine, right? I love it, Vanessa. I believe it or not, I was toggling between red and orange today. Well, thank you everybody for joining. We got some faces that I haven't seen in a while, so I certainly appreciate folks coming on to the September 2025 Supervisor Roundtable. I'm going to just jump right in and start with some brief introductions. I'm Vanya Howard. I'm a community health worker as well as a doula. I'm a consultant with the Alliance working currently in apprenticeship, but I will be transitioning to other roles in the near future. So it's good to be here. Either way, you'll see me around CHW town as well. And I'll hand it over to Shandy.
Good afternoon, everyone. My name is Shandy Potismangra, and I am the Workforce Development Coordinator with the Minnesota Community Health Worker Alliance. And I work alongside Vani, and we'll be taking on the new role of helping to facilitate these meetings. So delighted. I will pass it on to Tuesday.
Good afternoon, everyone. My name is Tuesday Glover, and I am a CHW as well, community health worker as well. Um, I am a social worker and decided to go back to school and get the certification. So I was so excited about that. Learned a lot. I am the director at Volunteers of America Culturally Responsive Caregiver Support and Dementia Services team. And we also have a team of CHWs that serve the community. And I will pass it to Keisha.
Greetings, everyone. Happy Friday. I am Keisha Hazlett. I consider myself a nurse. Love it, and a community health worker instructor. And my passion is around supporting the workforce with healthcare education so that we can always improve our health outcomes, whether it's in the public sector or in the private sector. So I will pass it on to.
I'm sorry, Keisha. Let me pass it to Sunny Ainley, our interim
Okay.
executive director, and then we'll go round robin.
Okay.
You can pass it on to another person when you're done. Thanks, Keisha.
Perfect. You're welcome.
Sounds great. Hi, I'm Sunny Ainley, and I am the intern executive director for Minchwa, the Alliance. And it's my absolute pleasure to be here with everybody today. And I think the first thing I just want to say is thank you for being here and thank you for caring enough about the profession and your community and your clients and your team to invest this time because I know it's really valuable. And I just want to say that on behalf of the Alliance, I walked into an amazing environment where the Alliance has experienced an enormous amount of growth and movement. And so we're looking forward to the next year of continuing that and also focusing a little bit of strategic alignment and, system setup. And you guys are a deep part of that, and we appreciate that. So it's my honor to be here and meet you guys. And also I hope to see you in balmy Bemidji in November, maybe? Yeah? Show of hands, like who's going to be there?
Bemidji is always balmy.
It is.
Don't let them tell you otherwise.
It's my homeland, so it's always God's country to me. But so thank you, and I appreciate being able to spend time with you guys. And I'm going to pass it on to maybe I'll pass it on to Vanessa, if that's okay.
Hi, everybody. I'm Vanessa Southworth. I'm the Community Wellbeing Director at Winona Health and also the CHW Supervisor here. Not a CHW, but definitely a CHW supporter. I came on like right at 12 o'clock, so I don't know if I missed anybody that might have already gone. I'm gonna pass it on to John if he hasn't gone yet.
Thank you, Vanessa. I'm John Fick, Network Director for Sanford Health Group in Bemidji, and leading the creation of the Northwest Minnesota Community Health Worker Hub in a 4-county, 3-tribal nation region in Northwest Minnesota. How about Rachel?
Hello, my name is Rachel Stahl. I am with the Minnesota Community Health Worker Alliance. I am a community health worker and I'm the education manager at the Alliance. Good to see you guys. Oh, and I've got to pass it. I will pass to Laura.
Hi, everyone. I'm Laura Turek, and I work with the Minnesota Department of Health in the Community Health Worker Initiatives unit, and I am the evaluator, and I get to work with measurement and data work for the CHW stuff. And I just love working with this group. So thanks for having me today. I'll pass it to Kristen Godfrey-Walter.
Hi, everyone. I work with Laura at the Minnesota Department of Health. I'm a CHW ally, and we partner at MDH closely with the Minnesota Community Health Worker Alliance on a number of initiatives, as well as with all of you and your organizations as CHWs and stakeholders. So happy to be here. And I will pass it to, I'm just looking at my screen. Ann Gainey, did you already go? Okay.
I did not. So thanks, Kristen. I'm Ann Gainey. I also work with the Minnesota Community Health Worker Alliance. I used to facilitate this group, so I recognize a lot of you. I'm happy to be here today to talk about our new sustainable plan. And I will pass this to Tessa.
Hi, I'm Tessa. I'm the Executive Director of Ready, Set, Smile. We're a dental organization in the Twin Cities that uses about half our staff are community health workers. So heavily supportive of everything with the community health worker world. And I will pass it on to the Luz D.
Yes, hi. This is Luz Duval with Des Moines Valley Health and Human Services. I'm a community health worker, and I adjunct with Roxanne Hayenga at Minnesota West Technical College, and also part of the Minchua Education Committee or Educational Committee. And I'm glad to be back. I have been absent to this group. I was completing my bachelor's degree in public health, so I completed that, and now I'm back. Thank you. Sorry, I have to pass it to somebody. Let me see who's hasn't. Heidi, I think she hasn't gone.
Thanks, Luz. My name is Heidi Carlson. I am a practice improvement specialist with the Minnesota Department of Health Healthcare Homes Project, or program. And we support primary care clinics, many of which use community health workers, doing a lot of care coordination, and very much a strong supporter of community health workers and the work they do. And I will pass it to, is it Cassia?
Thank you. I went already.
Okay. Oh, okay. How about Katie?
Hi, I'm Katie. I'm with Leech Lake Maternal Child Health. I'm still fairly new to this group. We just hired a community health worker in June. Please forgive me, I have my camera off because I am eating lunch. Who else still needs to go? I jumped on late. Isabella, do you want to go?
you. Yes, I'm Isabella. I'm the program coordinator at Open Arms of Minnesota. We do medically tailored meals for people with life-altering illnesses, and we're kind of in the formation stage of building capacity for a CHW program. So excited to be here to learn from you all. And I will pass it to, yes, what says ACLA, but I'm guessing you have a different name.
Yeah, it's under ACLA, but it's Miriam Goodson. I'm in Rochester, Minnesota, serving the surrounding areas too, and also building capacity with the community health workers. And I see a lot of familiar faces. I'm glad to be reconnecting again. We're really supporting the community health workers' career and work. The workforce is needed. So let's work together and figure out how to support our community. Thank you.
Thank
Oh,
you.
sorry. Let me pass it to somebody else. I don't know either. Banji, somebody help out. I do not know who is missing.
It is just fine. Thank you, Miriam. How about you, Tessa?
I already went. Di, Lou?
Who are we missing?
Hi, Miss Bonnie. This is Di. My name is Di, and I used to work for the American Cancer Society and the SAGE program, where we would provide spots and time for our CHWs to do community outreach around cancer. And now I work for the Minnesota Department of Health in the Health Equity Division. And the project that I'm on is COVID community coordinators. We have 38 CCC for short. Community partners or contractors, and they employ CSWs like WellShare and many others. So I'm very interested in furthering and supporting this work, and I hope to also be there in the November, the Rural CSW conference, because I used to go there quite a bit, and now with my new job, I'm just trying to get back into it. Thank you for having me here.
Yeah, thank you. Did we miss anyone else? Feel free to pop on and introduce yourself where you work.
I joined a little bit late, so I apologize. Hi, I'm Chelsea Kirkland. I'm a she, her pronouns. I'm a researcher in the Center for Public Health Systems at University of Minnesota School of Public Health. I am a former CHW and now a CHW ally, working to support the CHW workforce.
Thank you, Chelsea. I think we have gotten everyone now. If not, hi, Kirsten.
Hi, Buju. Kirsten Whitman. I am with the Leech Lake Band of Ojibwe in a new program called the Bobby Wish. So we focus right now on substance abuse prevention, but we'd like to expand into community health workers. So we're fairly new too, but we're super to more.
Thank you so much. Okay, now I think we got everyone. Am I right? Let's see. I'm going to check out the chat real quick. I see some items in the chat. Tuesday is asking if anyone has a flyer for the Rural CHW conference to share. Rachel, would you be able to send something out after the meeting to folks?
I don't have a flyer, but I can I'll put the web page in the chat for folks.
Thank you. So we will get going with the agenda. Today, we wanted to spend time updating the community regarding apprenticeship, regarding all of the statewide work that MNCHWA and MDH has been doing with all of the stakeholders and partners across the state. So first, I want to start with a promo video that we did as a highlight for one of our registered apprenticeship sites, Ready, Set, Smile, which, as you heard, Tessa is operating as the Journey Worker, or I'm sorry, she was the Journey Worker mentor. They have a new Journey Worker mentor at Ready, Set, Smile, but MNCHWA did a video highlighting this program and would like to share it with all of you. We did it back in March of this year, I believe. And so we were really excited to share it, not only with RSS, but also with the community of stakeholders and everyone across the state of Minnesota. It can be found on our YouTube page. And I am going to share it with all of you right now. Give me just a second. Can everyone see my screen? Good, all righty.
The successful apprenticeship program
Vanya, we
looks
see
just
the
like Ready,
agenda.
Set, Smile. Ready, Set, Smile is a school.
What was that?
Sorry, we can see your screen. It's the one with the agenda on it.
Oh, give me a second.
Mhm.
Because that's not what I wanted y'all to see. How about now?
That's good. Now we see the
Yep, we
video.
see it.
All right, let me
Thanks,
just
Wayne.
start those 11 seconds over for us. Is there sound?
We can't hear it yet.
No, we can't hear it. There's a little button. You might need to go back and restart it. There's a little button that you have to push underneath the video to get the sound to play.
Okay.
Communities where children.
Okay, let's try again. I saw the button. I've never played it through the audio player, so let's try this again. I think we got it. Thanks, Ann.
Yeah.
Everybody see the screen now? Okay.
The successful apprenticeship program looks just like Ready, Set, Smile. Ready, Set, Smile is a school-based program. We serve children that do not access dental care. So we go into communities where children come from families of low resources. We understand that this huge health disparity impacts these children greatly, and we are trying to turn that around. Ready, Set, Smile has invested in their CHW apprentices. They have promoted their apprentices. They are in it for the long haul. Community health workers make up the backbone of our organization. I believe in that long-term systems change, right? I believe that health and oral health is health and that all people have a right to health access and to health literacy, but also to health care, to understanding what's happening in their bodies, but also in getting the support they need for it. And I just have not seen a more effective tool than a community health worker. Apprenticeships are something that's not very new. In fact, some of the first legislation that was passed around apprenticeship models come from the 20th century. So apprenticeship models are something that have been primarily around to help support workers within construction and the manufacturing industry. But within the last years or so, we've seen quite an interest in apprenticeship model working for other industries as well. That includes healthcare. Within the state of Minnesota, community health workers have been something that has been around since the early 2000s. But we continue to see a lot of structural and organizational barriers to community health workers and entry into employment, as well as for employers to really fully wrap their minds around how can we best recruit CHWs as well as retain them, as well as onboard and train and help develop their leadership throughout our organization so that they stay. The value of the CHW apprenticeship program is that it will allow for CHWs to receive structured on-the-job training while they are working, as well as receiving academic training through the CHW certificate training program. We benefit in many different ways, but I think the biggest one is the additional advantage it gives us in hiring and retaining excellent staff. So we really believe in the community health worker model and in the work that community health workers can do to bridge the gap between families and services and to work with system change. And we want people to be in these careers, and we want people to be in these careers for a long time. And so it helps us both introduce people to a career that they may never have heard about or wouldn't have known about, but also something that is a career ladder where they can move forward and get better pay here and other places. So it both in finding staff and in getting them to stay. And I think they stay because they love the mission, but they also stay because they're getting professional development and their career is advancing.
all three of our managers and supervisors are community health workers because we believe not just in the model, but also in growing people into greater positions. And I do think, I don't think people should be leading public and community health if they haven't been in the field. And the people that we are producing through this leadership program, through Apprentice, but also through working here, are people who can lead these programs anywhere. Apprenticeship also offers a space where CHWs are able to learn and grow within that profession to develop and perhaps go on to leadership positions.
I still learned a lot by being on site and doing hands-on things, especially like practical skills that really helped. And it was very nice because I knew that I was in a supportive environment, and it just allowed me to be even more comfortable and confident as I was learning those skills. I learned how to build trusting relationships with the community. I learned more about the challenges and barriers that the community faces. I also learned how to be a successful oral health assistant, school liaison, which all were crucial to helping us achieve our mission. And shortly after that, I was promoted to be an operations director. That base knowledge that I learned during that initial period really helped me because I was really able to learn the kind of ins and outs of how we work. And so I'm thankful that they trusted me to take on this position and gave me the confidence to be able to do so.
Apprenticeship allows for a CHW entering into the field to learn and grow, but to also have relatable on-the-job experiences that they can reflect back on what they've learned in their academic training so that they have that real-life experience coming into the profession as well as concurrently receiving their certificate training.
The mentorship part was very special and important to me because it was really a time for me to kind of take a step back and really reflect on what I was doing. It helped me feel even more supported, not just by Ready, Set, Smile, but by the Alliance as well. And I'd also like to highlight that I not only felt supported as a CHW, but as an individual as well, which made it even more special.
CHWs going through the apprenticeship program, they are already getting their education, their certificate through the Minnesota State curriculum in order to become CHWs, right? And they're obtaining acquired knowledge through that education. But at the same time, as an apprentice, when they work for an employer, they are able to then facilitate sort of on-the-job practical experience, that experiential learning that will help emphasize the work that they're going to be doing day to day, building the essential skills as a community health worker. All along the way, they are helped and supported by journey workers or mentors within the organization that they're employed with. And throughout that process, there's going to be opportunities for them to be supported not only by their employer, but also by the Minnesota Community Health Worker Alliance.
It is just a hands-on thing. You learn about health promotion, culture, humility. It is just like a paper thing. But then when you are actually doing it, when you encounter those events as you go on, you kind of listen to that lecture and then you go to an event today and then you meet like the same thing that you just read. It just hits different. So having those like hands-on actually helps the CHWs or like the employees to actually reflect on it and see like how this is not just topics we're talking about, but it's a real thing that's happening.
For someone like me as a CHW who's worked in various sectors, apprenticeship would have been key for my professional development. The experience that I have being a CHW since 2008 was all acquired through multiple jobs in multiple settings. Apprenticeship at that time, coming through the CHW profession for myself, would have been a key component in being able to acquire those skills and trainings on the job without having to job hop or be employed in so many different spaces.
Ready, Set, Smile has grown very quickly. Now, we had the pandemic slow us down, but literally since the pandemic, every year we are growing exponentially. So where do you find staff when you're growing that quickly? So the apprenticeship program has given us that pipeline so that we can bring in people who reflect the communities that we serve and get our robust training in oral health and go out into community and connect with our families. They touch every aspect of our program. What's unique about Ready, Set, Smile is because we're a dental program, we also have to serve the public with the services of dental care. Now, the community health workers work at every one of those levels, even to the point of being trained to be a dental assistant in our clinic. So, like I said, they are key to our work. What we are seeing is that the programs and services that CHWs provide in various settings can really truly be upskilled as far as being able to provide additional services and supports that maybe the organization did not envision. But now they get a CHW who is well-rounded, coming through the program as a CHW being trained on the job. They're able to provide and perhaps even develop what a standard is for the CHW role and scope of practice.
It helps with us in a couple of different ways. So one is definitely that it helps us structure and think about career development, professional development. We have many categories of things that we want our community health workers to know and to do really well. The apprenticeship program helps us think of those in very specific, distinct categories and sort of make sure we're addressing the different issues. It also helps us, I think it helps each individual apprentice also see that they are progressing on a route of professionalism and development. And it certainly also gives them something to show. This is what I've done. This is how I've progressed. This is what I've learned. It was, okay, I took this training, this other, and sort of aligning those, like these trainings helped me do this work in the field helped me learn and understand this. I think it helps connect a lot of those dots. The Alliance provides support to the employers throughout the one-year apprenticeship program. What that support looks like is perhaps an employer does not have a vision about how they would like to utilize a CHW, or maybe they have a question about what are the key components of the role and scope of practice.
As an employer that's potentially looking at the idea of hiring a community health worker, there's been a lot of barriers and challenges around employment. Is there enough community health workers in the state of Minnesota? And how do we bill, et cetera, et cetera? And I think where the Minnesota Community Health Worker Alliance comes into play is to help support the employer in terms of understanding, like, what is the scope and the role of a CHW within as a community health worker, but as within the organization itself, how do we help employers understand what navigate that and where CHWs belong within their organization?
Another aspect of support that the Alliance provides to the employer is assisting them to understand where a CHW can be utilized, but also where they cannot be utilized. We also provide support with trainings, and that could mean what trainings might be appropriate for CHWs to achieve outcomes in a certain program or service area.
What's exciting about the apprenticeship program is it's a great way for employers who have never hired a CHW, right, to sort of gain that support that they need in order to build out the structures and the support mechanisms for community health workers to be successful in their organization. And the apprenticeship model is just such a really good medium point for both addressing the support of employers as well as CHWs. And I think for new employers or potential employers, this is a really great opportunity to kind of enter into an apprenticeship model to help bring CHWs on board, to help with understanding the scope and the role of CHWs, to help understand the onboarding process, understand what it would mean to retain really valuable CHWs.
The Alliance also provides employers with support regarding moving through the apprenticeship program if that employer would like to become an apprenticeship site. We support employers hands-on every step of the way throughout the registered apprenticeship process. And having gone through the process ourselves, we have a lot of knowledge in that area. The Alliance can provide employers with the basics of how a supervisor can support a CHW within an organization. CHWs do need to have strong advocacy, not only for themselves, but they need to have strong advocacy from their supervisors. A supervisor's role could be that they are helping others on the team to understand the role and scope of practice of a CHW. So if an apprenticeship site or an employer is struggling in that area, we can offer support there as well. The importance of community health work is primary. Like as the systems that we live in exist today, and probably for a little while longer at least, helping people get access to what they deserve and that they are not just eligible for, but really have a right to in different services, both social services, but certainly health and health services. Like that is essential. If we're not doing that, we're not serving the community. We're leaving people by the wayside, right? So I think community health workers do that. And the more we can professionalize our field and ask people to do well and to do things at a high quality level and to be able to show it, the more legitimacy our field has. I think community health workers are wildly important, and things like the apprenticeship program help you demonstrate that this is not just, I'm not just taking someone off the street and being like, hey, can you talk to someone? We're taking someone who has a passion for the community and a passion for access and for people and giving them skills and tools to be able to make systems work for people. And so I think it certainly has helped us retain and keep staff, but it also helps us professionalize and develop and really advocate for the field overall.
A successful apprenticeship program looks just like Ready, Set, Smile. Ready, Set, Smile has invested in their CHW apprentices. They have promoted their apprentices. They are in it for the long haul. Not only as an organization have they grown, but they have grown within their CHW workforce internally. And so Ready, Set, Smile is a great example of how apprenticeship allows for an organization to train, sustain, and promote CHWs.
The Alliance was super excited and proud of being able to create this video with Ready, Set, Smile. We thank them so much for all of the work that they're doing investing in the CHW profession. And we would be, of course, remiss not to mention our other apprenticeship sites, Winona Health Services in Winona, Neighborhood Health Source in Minneapolis, drawing a blank here, the Alliance, but also ACLA just joined us. And I don't think I missed anybody else. So we are very proud of the apprenticeship program and how far it has come, and also just very thankful for those employers who have signed on to apprenticeship to train, sustain, and retain their CHWs across the field. Does anybody have any remarks about the video? Thank you so much for being here, Tessa. I know we shared the video with you some months ago, but we'd like to hear feedback. We have a couple minutes to get your remarks about the process of apprenticeship, but also how things are going for RSS.
Yeah, I mean, it's going very well. We, in addition to the apprenticeship model, we've now become a site for the dual pipeline training program, which is a grant between, sort of a share grant between the Minnesota Department of Higher Ed and the Labor and Industry. And it also allows us to provide tuition assistance for CHW programs and for other dental programs that help us. So I feel like this has really helped us launch into a full but a full dental workforce promotion effort. And I think it's been really exciting. It's really great for our staff. It's great for the field that we want to improve.
Thank you, Tessa. Anyone else want to share any brief remarks? Yes,
Just
Beth?
what an amazing testament to the work that is being done. That was just so cool to see. So thank you for sharing your story.
You know, I was going to add, to this day, I talked about this morning, are learning more about billing. And so I think, we were really lucky to get some help from CHW Solutions with a little bit of guidance, but also because it's dental, it's different from some others. Like there's just so many aspects of it. And I think that's been a really big key, that because it is not covering our expenses in any way yet, the CHW billing, but we are feeling like we're getting closer to increasing it, which is a big deal.
Thank you again, Tessa, and all of our registered apprenticeship sites that are represented here at today's Supervisor Roundtable. We will move right along with the agenda. Shandy will be sharing some information about the Alliance's registered apprenticeship program and signatory employers and sponsors and kind of what that relationship looks like. I'll hand it over to you, Shandy.
Sounds good. Thanks, Winnie. So as you saw in the video with Ready, Set, Smile, it is such a great example of, I mean, Ready, Set, Smile itself is a great example of what a registered apprenticeship program could look like for an employer. In the past, when Bunny has gone out and done a lot of outreaching in the last year or two, year and a half, there's been a lot of conversation about apprenticeships. And so I'm sure this is nothing new for a lot of folks on this call. What has changed actually has been the change in the Alliance's role with how we have these conversations around apprenticeships. We registered to be a sponsor with the Department of Labor, which gives us an ability to help support employers who want to be an apprenticeship site but don't have the resources to necessarily meet the requirements that DLI has for CHW apprenticeships. So that I'm going to go ahead and share my screen and show kind of a display the requirements briefly. This is something that I won't go into detail today. We actually are planning on having Leslie from Department of Labor come in October to speak a little bit more about it. But I will just speak to the fact that we are a sponsor and what that difference is between being a sponsor and where Ready, Set, Smile and Winona Health Services, as well as being their own apprenticeship site, we operate a little bit differently. So we are actually supporting the employer in meeting these commitments and requirements that employers have when they sign on to be an apprenticeship program. There's quite a lot of trainings, as you see on the screen here, that are required for apprentices, and that has been a big barrier for employers to who really do want and see the excitement and see the benefit of an apprenticeship program, but are really struggling with making sure that they have the ability to provide these trainings and meet the requirements. So as a sponsor, this sort of outlays, let me go ahead and make this bigger. This sort of lays out basically an idea of where is the sponsor coming from? What is the role of the Alliance when an employer decides they want an apprenticeship, they want to be part of an apprenticeship program under the sponsorship of the Alliance, because they realize, again, the benefits of an apprenticeship, but aren't able to be their own site on their own. The sponsor basically has the role of helping what we're referring to as signatory employer by the Department of Labor. That's the language they use. The signatory employer signs on to become an apprenticeship, part of the apprenticeship program with us. And we do the paperwork through DLI's system and software in Rapids. And that's a lot of administration, that kind of something that we help with. And we also support the training mechanism. So to be able to provide a certain amount of, for example, safety trainings, that's something that, again, employers have difficulty with. And that's something that we are taking on as a sponsor to help provide to employers. Additionally, we help support with continuing education, professional development, not only for just the apprentice, but as well as the CHW supervisor, the mentee, or the journey worker, as they call it in the Department of Labor, the folks that are trying to build the CHW services and programming for their organizations, but need support in implementing and utilizing CHWs. That's something that as a sponsor, we're really passionate about wanting to do. And that's just something that the Alliance has always sort of stood on. So we're really excited that this is a component of the apprenticeship as a sponsor. For the signatory employer, it's the same setup as if you were operating your own apprenticeship program. You would manage the hiring of CHWs, the recruitment of CHWs, whatever that process looks like to you today. You would be responsible for choosing who the mentor or the journey worker is for your apprentice, as well as reporting. There has to be communication between the sponsor and the signatory employer. So deciding who that is and how often we set up communication is something that we set up between, is unique to each signatory employer that we have relations with. And then the overall administrative side of the apprenticeship only for your site. So you don't have to worry about any other programming, other apprentices at other sites. It's really managing your own administrative role within your organization. In the middle in the green, you'll see that there's really at the heart of apprenticeships, I believe, and the Alliance really supports, is this idea that both signatory employers, organizations that hire CHWs or want to hire CHWs, we want to see improvements in health outcomes for our communities. We want to see a better integration of CHWs and increase employment for CHWs. Data collection and reporting is such an important asset to increasing the number of CHWs working for employers, because we see if we can tell the story, we have a CHW impact, we will be able to increase the roles of CHWs within the field. Ensuring apprenticeship meets requirements, that's just something that both the sponsor and the signatory employer would do, not alone, but with the help of the sponsor, we would help you meet those requirements. Supporting organizational readiness is something that is a way that we assess organizations. I think this is also going to be available to non-signatory employers as well, but there's maybe an addition that is a part of our sponsorship that we would provide this organizational readiness assessment. And then to strengthen CHW profession overall. And I think that's kind of where I want to stop with talking about sponsorship. Actually, I think there's maybe one more slide that's really helpful, is to kind of see the overall, and kind of at a glance, what the employer benefits would be if you signed on with the Alliance. It would be receiving some forms of technical assistance, have regularly engaging in quarterly meetings with other apprenticeship sites, as well as signatory employers, being able to access our training platform as part of being a signatory employer. This is something that we are also looking at making available to other employers who are not signatory employers, but this again is a benefit that would be included for a signatory employer to an extent. And then peer support for our apprentices. National recognition is still available to signatory employers just as much as it is available to apprenticeship sites. And I believe that's where I'll stop. So there's more to come, more conversation to be had next month about the apprenticeships and what it means to be a sponsor, or what it means to be your own registered apprenticeship program, which is also something that we are also a resource for talking to employers if they're interested in that as well. And I think that's it, Bunny, for what I would like to talk about for apprenticeships.
Quick question, Shandy, just to make sure. You also serve as a partner with the college. So I don't know if you mentioned it, but that's something like a sponsor. You're helping us get that scholarships.
Yeah.
Am I right?
Yes. And as part of our partnership with the Minnesota Department of Health, and I think Bonnie can speak a little bit more to it before I move on to the next topic. And actually, Miriam, I forgot to announce, Miriam is actually is joining us as a signatory employer. She herself is going to be a journey worker for her apprentice. We're very excited to have you on.
Yes,
so thank you so much.
I am so thankful because it's a dream come true. We know the need. The storytelling that you put together in that video is talking about how we can support each other, and because labor needs training, and sometimes they need, a lot of the immigrant community need that kind of recognition, certification, profiles that are gonna show how capable they are in this kind of immigration environment that we're dealing with. And they are so willing to do something like this because they love the community. This is kind of a social work profession that is more accessible to all.
Absolutely.
Thank you. Thank you both. Rachel, I saw you pop on. Shandy, you mentioned the scholarship, I believe. I think Rachel would be a better person to talk about that. But Miriam, could you clarify what you said regarding the scholarship so we can make sure that we're giving that information accurately?
The support comes because we know that it exists through the sponsorship, and that way the colleges are willing to take us. There are some barriers still because a lot of the people sometimes don't have the paperwork from their past schooling ready, and has been a barrier. They sometimes it's in another language and they want it to be certified. So they're hoops and loops that we still need to work on. And the sponsor is being so patient with us. That's one thing that not everybody is willing to wait to work with us for a longer time.
Thank you. Rachel, did you want to add anything about the scholarship?
So the the scholarships that we've been offering for the last several years have been through a HRSA funded grant through the Minnesota Department of Health. The HRSA funded grant through the Minnesota Department of Health is ending in 2 days. The end of the grant period is in 2 days. We have asked to have a no-cost continuation where we would be able to continue to support existing trainees, but we won't have additional scholarship dollars going forward after now, I guess. So we do have a new page on our website. So we are going to continue to seek funding for supporting students with the CHW certificate directly. I think one of the biggest going forward, I think one of the most reliable ways to have employers assist their employees in getting the certificate paid for is going to be through the apprenticeship program, through the Alliance Apprenticeship Program, because being an apprenticeship site gives us access to apply for funds at DLI and DEED for sort of that support. And so the pipeline grant that was mentioned earlier can pay for the certificate. There are other opportunities. And then I also have created a form on our website for any students who are interested in getting the certificate where the cost may be a barrier. This form is just an information form where students can tell us a little bit about themselves. This will help guide what funding we look for to support scholarships. And then if any opportunities become available, the information on this form will help us do targeted outreach to recruit students for those scholarship opportunities. So I'll share this link with you guys. You can share it with your CHWs. But I do think that those opportunities like Pipeline and other Department of Labor opportunities may be the most reliable and stable continuing support for tuition for the CHW certificate.
Thank you, Rachel. And thank you, Miriam, as well as Shandy. We can move along on our agenda. Shandy, did you want to share any information regarding wages that you may have not touched on in your previous presentation?
Yes, yeah, I was going to go over that briefly. I know I went a little over time, so let me just quickly show what I was going to show everybody was the data center that on the DEED website. That's really has been like a useful source for looking at salaries. I know this has been a continued conversation that folks have had about what's the right salary, like what's the right wage range for a CHW in my specific geographic location or area. And a great place to start would be the DEED website. So I'm going to actually go navigate us to that. Okay, can everyone see this, the DEED website, the data center here? Okay, so in brief, I won't go into this on your own time. You can really explore a lot, but I'll just kind of start you off and we'll put directions in when we send out the meeting minutes. But this is such a really useful tool for both employers as well as job seekers. So this is something I would advise for CHWs as well. Data tools is a great place to start, or data for businesses. It'll take you to very much the same tools. But when we go into data tools, what I think is really useful to see are three main things that I kind of looked at was cost of living, because depending on where you live, of course, the wages are going to look different, and you're going to want to know what the cost of living is for that region. And that's going to determine and really help you decide what the wages would be within your area as an employer. Additionally, county profiles is a good way to also look at like in-depth information. And so I'm going to go into one of them just to, for sake of time, just to show, this is not it. Trying to find what I was, sorry. Okay, let's go back here. that was not it. Okay, sorry. Occupational employment and wage statistics. That's a one that I have kind of gone to and been exploring. So here is actually a really great way to see in the state of Minnesota. You can also do by region, which I think is really cool. But just to make it easy for now, we're just going to look at Minnesota in general. Search community health workers. And what it's going to do is it's going to pull up for the state of Minnesota what the median wage is on average. CHWs are making $23.32 an hour. The highest paying CHWs in the state, across the state, is $33.94. And this is such a quick snapshot of what you can be looking at and looking for. Additionally, you can, again, like I mentioned, go by region. So if we look at, for example, Northeast Minnesota, you'll see that the median changes and the highest earning CHWs changes for that region. This is such a great way to start. There's one more, I think there's one more thing I would probably want to show, and that is cost of living. So when we look here, we can say that, for example, let's do, let's see, central, the 7-county area. If we do a 7-county area and we see that the median wage is $23 an hour, highest paying folks is 35. Remembering that wage right here, the median wage at $23 an hour, we can go to cost of living for Minnesota, and you can even then go by county. And so from here, it also takes the data and breaks it down into if a person is single or if they have a family. So just even doing a single person, we can see here the hourly wages that a person would have to kind of meet the household income for that county. So here, for example, Hennepin County, $33 an hour is ideal for living within this county. And so again, comparing that to the actual wages that CHWs are earning is another great way to be looking and really deciding for your organizations what's the right amount to be paying for CHW work. Is there any questions for this, or?
Do you know if there's, excuse me, do you know if there's anywhere where it's connecting those wages? Like, one of my thoughts is I wonder how much the higher end wages are also connected to the ability to bill for the CHW services. And I wonder if you have any information about that. Like, do you know that at all?
Are you talking about like different classes of CHWs, like a CHW, like I know Dakota County, I think, has like CHW 1 versus CHW 2?
No, I'm talking about whether or not the organization can bill, like, does an organization that can bill for the CHW and is successfully getting reimbursement pay more? Or is there not that consistent pattern?
I would not have the data to speak on that. And I don't know if DEET would probably not have that either. That's a great question though. I mean, I don't believe that on DEET I could break that one down, but that is, I'm assuming that the difference in pay has to do with, I think CHW supervisors are maybe included in that as well in the breakdown. So that's something to think about, as well as like CHWs that have been on for many years within an organization, they end up going, their pay increases with time. So that might be where we're seeing some of the highest paying CHWs. I mean, if anybody else has any other thoughts, please feel free to chime in. Or if you have,
do you want to speak to any of that, Laura? I think I just want to say that these are the kind of questions that we are hoping to have more and more information on. And we're going to talk in a little bit about the measurement plan, the statewide measurement plan for the state of Minnesota. So this is actually a really good segue. So I'll give you that teaser and then we can go back to the agenda.
Yeah,
I noted that question in our measurement bucket already. So thank you.
I want to acknowledge Tessa's chat question, is there any financial assistance or support for staff time for signatory employers? It probably would be great for Tessa for you to connect with Shandy offline from this, because I believe, Shandy, you're having conversations with DLI around employer assistance to go through the that staff time hours for signatory employers. So if Shandy does not have current information, she is in the process of getting that information. We've talked to them about that. So thank you for that question. And as Rachel and Laura mentioned, let's move on with the agenda. Rachel is our education manager at Menchua, and she has an update regarding the CHW Leadership Institute. So I'll let you take it away, Rachel.
Yeah, so this is going to be really brief. We just finished our 2025 Leadership Institute. We had an amazing class of folks, and we got to record some of their presentations, their leadership plan presentations on Tuesday. It's a really powerful experience. And we are going to put some of that content on our website. It's not up yet, but it will be. And so this is a teaser to make sure you're signed up for our newsletter and make sure that you check back on the Leadership Institute page of our website, which I'll stick in the chat right now. Because we are also going to be opening up applications for the 2026 Leadership Institute. We are hoping to do the Leadership Institute in 2026 from about February through June. It is 10 sessions, 2 in person that are pseudo all day. They're in St. Paul at our office, and we usually do them like 10 to 2 or 3 to give folks who are coming from outside the metro time to travel. And then we have 8 2-hour Zoom sessions between those two. And it's a really amazing experience for CHWs. I'm excited to have more of that content to put on our website to just show how transformative it can be for CHWs to see themselves as leaders. And we are going to have the application for the Leadership Institute 2026 up in October. It'll be open October through December 15th. And so notice I didn't say October 1st. I'm hoping October 1st, but might be October 2nd or 3rd. And we're trying to get a class of 15 to 20 CHWs, and we really rely on employers to support CHWs in taking advantage of those kind of opportunities for professional development. So I wanted to come here and just give you guys some information about it, share the website, and let you know that if you have any questions or you want to talk about what the commitment is as an employer to send someone to the CHW Leadership Institute, that you can reach out to me. My email address is on that website that I just shared, but I can also stick it in the chat. So just a plug for the Leadership Institute. It's a really amazing program. And just an interesting fact, every CHW who's employed at Menchua did go through the leadership program. So it shows, it gives, I know that you're always impressed with me and Vani and Shandy and all of us, and we all were participants in that leadership program. The other thing I'll say is that we're working to get an alumni network off the ground for the Leadership Institute. So if you or anyone you know are CHWs who have participated in the Leadership Institute, we'd love to get your updated email. A lot of CHWs gave us their work email and may have changed jobs. So there's also a button on that webpage I shared for a fillable form for Leadership Institute alumni to let us know how to connect with them best and to start building more of a network.
Thank you, Rachel. And to Rachel's point, likewise, I was impressed with our cohort of CHW Leadership Institute participants as well. So impressiveness all around here in this group, as well as around the CHW profession. So moving on with the agenda, we wanted to definitely spend some time with updates on all of the statewide work that Menchua and the Alliance, Menchua and MDH has been doing with our stakeholders. So Ann Gainey, Rachel Stoll, and Laura Turek from MDH will be providing those updates. And I think we have Ann going first. I'll hand it over to you all.
All right. Thank you, Vani. I am going to share my screen. Oh. And show you the webpage of the plan, because we now have, thanks to our partners at the Minnesota Department of Health, who worked very closely with us on creating this plan. We have a plan for a sustainable plan for community health workers in Minnesota. And this is available on our website. I put that link in the chat, and it includes the 3 different pieces that are part of it. First is the roadmap, which we'll take a look at. It's deep, so we aren't going to go into that in great detail. There's also a measurement plan and a logic model, and those are both fantastic tools that go along with the roadmap or the plan. So the goal of the plan, I'm just going to click on it. If I click on it, does it come up for you? Do you see? So the goal is right here: to develop, refine, and expand the CHW profession in Minnesota, to equip CHWs to address health needs and improve health outcomes. It has 9 objectives and 35 strategies, so you can see why I'm not going to go into it in great detail. But I can tell you that it promotes CHW voice and leadership in shaping and leading their profession. But also there's a large role for employers. If you look through all of the 9 objectives of the plan, you'll find employers are part of each of them, but there are 4 where they're really stressed. And one is objective 4, which is about increasing the number of CHWs in the workforce, which includes also support for supervisors. And then objective 6, integrating CHWs into the use of evidence-based models. That's an employer piece. Participating in measurement and evaluation, that's an objective 7. We're going to need everybody participating in that to put together the information, like the kinds of questions that you've raised just in this meeting today. And then objective 8 is about billing and getting employers to build as part of sustaining positions. So I'm going to stop sharing this document and bring up another one. Because we're working on a how to use this plan document, and we will get that out to you as soon as we can, as soon as it's finalized. But for employers, it says these are some of the bullets for employers. Use the plan to guide your work with CHWs, employ CHWs, work with the Alliance on the organizational readiness and planning. We have a lot of technical assistance that can be helpful to organizations, especially if CHW programs are new or expanding. Engage CHWs in the program design and ongoing planning. Use information in the plan in your own funding proposals. It should support your requests for money. Measure and share the results of your CHW services. Provide training and supervision time for CHW supervisors. Consider the apprenticeship model or the Alliance's apprenticeship that we heard so much about earlier today, and use the available billing and reimbursement to sustain your services and integrate CHW services into budgets and existing resources. Since there are cost savings associated with them, there are places they can fit into budgets. So I just wanted to share some of those suggestions for employers. We will have that available shortly, and we'll get it out to the Supervisor Roundtable mailing list and put it on our website as well. But so it's very exciting to have a plan and a roadmap, and I'm going to turn it over to Rachel to talk about the measurement plan.
Thanks, Anne. Yes, we've been very hard at work on this. So one of the links that you saw when Anne shared the webpage is that there's a whole measurement plan that is distinct inside of the sustainable plan, and we are hitting the ground running with that. On the first page of the measurement plan or the second page, there's a draft timeline, and the things that are coming up fast, I'll just want to sort of give you guys a little bit of insight into what's coming so that you aren't surprised and you can help participate with us. And then some of the things that we want to tap employers for. So the biggest thing that we're working on right now is recruiting people to join us in a work group that is going to implement this sustainable plan and this measurement plan, specifically the measurement plan. So we had a group of stakeholders, we had a work group that was focused on creating this measurement plan. We made that plan as a group. All of those folks who are involved in that earlier work group are welcome to join this implementation work group, but we want to open the invitation up to more folks. We really want CHWs on that work group, and we also want employers. So if anyone is interested in that, after I'm done talking, I'll put my email in the chat. Just send me a note. I'm keeping track of those, and we're hoping to meet in the next few weeks to really talk about the nuts and bolts. Okay, we made this great plan. Now how do we actually follow the plan? So that's big. The other thing we've already launched is a statewide community health workers survey. And you guys are going to be just like bombed with links, but I'm going to send you a link in the chat of the statewide CHW survey. We would like to get every single CHW in the state to take the survey. I know that might be a high goal, but every CHW that you employ, I would love it if you would encourage them to take this survey. We are going to be collecting all this information and putting it together and analyzing it. It will be de-identified and put in a public report. This is based on the CHW CRE common indicators. So we're collecting data that is being collected all over the country on CHWs. And it's data that will really help us see where we are, where the CHW workforce is now and where we might want to go. So if you employ CHWs, which I bet you do if you're here, please send this out to your CHWs and encourage them to complete it. We also are going to be developing a employer survey that's also based on the CHW CRE common indicators, and that will be launched next month. And so you will be sent that survey as well. And we would love it if CHW employers, every CHW employer in the state also completes that survey. It asks some similar questions, but in a little bit of a different way. And that, like our CHW survey asks about starting wage and finishing wage, and our employer survey will get down into those nitty gritties, like is your organization billing for services? And like that exact question that was asked earlier, like, are you billing? And then we can compare folks who said they are billing. What are the wages? What is the wage range for CHWs that they report? So it is, I think there's sometimes people get a little bit nervous about submitting that kind of data, but we just really want to be able to answer that question for CHWs or for CHW employers, what those appropriate ranges are. And then the last thing that I'll say is that starting in November, we are hoping to start drafting toolkits that are based on settings. So one of the things that came out of the measurement plan is that we at the Alliance will measure things. A lot of state agencies measure things, but there are certain things that are really, really important to measure that can be measured best in particular settings. So community health workers, CHW CRE, in addition to the employer survey and the CHW survey, they also have a CHW program participant survey. And so we want to have a toolkit for a setting like, so let's say you employ CHWs in a clinical setting. We want to get a bunch of folks together to say, how can we create a toolkit to help everybody measure their CHW program in a similar way so that we can bring all that data together and help each other learn. And so those toolkits by setting are going to be we really need people from those settings if we want those toolkits to be useful. So that's another thing we're going to be recruiting you for in the future. Does anyone have any questions about the measurement plan? Anne showed you it's available on our website. You can peruse the whole thing. We're really excited to really understand our profession better and to give CHWs the opportunity to study our own profession. Okay, if nobody has questions, I'll pass it off to Laura. I've been working really closely with Laura on the measurement plan, so I think you're talking about the environmental scan, but you're welcome to say anything else that I might have forgotten about the measurement plan too.
Perfect. Thank you. Well, you guys, this is just so exciting. I really am jazzed by all the things that are coming to fruition here after so much hard work by so many fine people. So this is awesome. My role, I'm Laura. I work at the Minnesota Department of Health. And when I came on maybe a year and a half ago, I got to start with trying to do an environmental scan. I spoke with many of you or your CHWs or people in your area that don't know anything about CHWs yet and are not sure where that goes for them, and got to document that into an environmental scan report. And we use that as kind of a launch point for what we know as a collective about CHWs, knowing that it was flawed because there's so much going on out there. And so right now we're trying to update that with as much as we can around things like tribal nations, unhoused folks, people from different corners of Minnesota that have different situations, culturally, environmentally, all the different ways that geography impacts healthcare. And so then we have developed, so anyway, I'll be reaching out to a lot of you in different ways around that as well. But then we have this logic model that we developed. And so the scan was kind of a basis for where we were headed. We gathered all these folks together with what Anne spoke to about the sustainable plan and the measurement plan, like how are we going to know? And I think earlier in the chat when Rachel was talking, I tucked in the 4 big questions that we're trying to answer with that measurement plan, which are those common indicators across the country. And so part of my role was to investigate what other states are doing. And one cool thing we learned was that Minnesota is really a front runner. We're doing amazing things and we're right on the front edge. And we have obviously the best people right here. So we're excited to continue down this path. But one way to go down that path is to jump into the logic model and see where the work that you're already doing is fitting. And so we have these different objectives that Anne described, and we have outcomes we're hoping for, and we have that messy middle where we want to see what people are actually doing to get us there. The measurement plan is intended to go alongside to kind of quantify and describe with stories what that work looks like so that we can replicate it, or better describe to people with decision-making power around funding. So if we can show exactly how something works, we can make a case for why you should pay for it and why we should reimburse people at a higher rate, or why we should have different scales of where people work. They have different roles and different supervisory kind of tiered roles. So the logic model is meant to be for everyone in Minnesota, not just for one group or one grant, which is kind of a different move on our part. But what we're hoping is that you and your role in your community will look at that logic model and say, yeah, I'm already doing 3 of these things. And then let us know what you're doing so that we can document where all this effort is happening. And that will be the messy middle part to be documented by the measurement squad. So our measurement work group is going to be working. And if anyone's interested, please join us. But how do we document all this? How do we pull threads for what it means? How do we describe the evidence-based models that maybe have never been documented before, but they're amazing models that are working? And so we know that work is happening out there, but we don't know exactly where, as evidenced by the environmental scan, had a lot of gaps in it. We only knew part of what's going on. And so we'll be updating that as best we can, periodically, and we'll be pulling data from state agencies, which is kind of fun. They showed you a great resource with the DEED website, but we also have the number of people getting certificates and where they're coming from geographically and culturally. We're trying to get people to tell us who's billing for claims. And so working with the Department of Human Services to find out where that's coming from, who's being successful with that, who's struggling with that, and then how we can adapt the great work that Anne described and that Vanyi and the whole team are doing to support people as they try to navigate their way through that. So I'll leave it there, but I just wanted to let people know that I really encourage you to actually click on the logic model. It is big, and we're here to help interpret that. So if that's too much for you and you're saying, my brain is full of other things that feel more important, you can contact anyone at the Alliance or myself or Kristen and say, you tell me what you're doing and I'll tell you where you fit in the logic model. And then we can shortcut it that way too. Because I don't want it to be a barrier to realizing how you are already engaged in the work and what the cool things are that we're measuring collectively. So I'll
think
check my
that's a-
email in. Does that work?
That's a really important point, Laura, is that you're already doing the work. So you're already somewhere on that logic model. It's not adding more. It's noting where you are and what you're doing. And it's a really great tool. I admit that it looks very daunting when you first click on it because it's big, but you're already there. And so we just need to find where you are.
Awesome. Thank you, Laura, Rachel, and Anne. Does anyone have any questions about anything at all that was just stated about all of the work statewide that we're doing, or about anything else that was covered today? We have a little bit of time and we can certainly either end early or take your questions.
Bunny, can I say one thing? I just want to thank Kristen and Laura for their partnership and the support of MDH. We couldn't do this work without that. And Kristen and Laura have been such great partners and at building our own capacity and helping us think through things. So truly is a new model of work, I think, at MDH, and we really appreciate that support.
Definitely.
Thanks, Anne. We appreciate likewise all of the partnership and working with the Alliance so closely to build the infrastructure in the state, and of course with all of you on the call as well. So glad we're able to move forward with that work.
Any last remarks from anyone? Or is there anything from your organizations, any events that you'd like to share while we have some time? You can feel free to either stick it in the chat or come on camera and let us know about all of the wonderful things that are happening at your organization in the future with events. Or any announcements? Well, all right.
Yes, I have one announcement.
Okay.
Latino Fest in Rochester, Minnesota is happening September 20th. As you know, is Hispanic Heritage Month, starting September 15 all the way till October 15. So if you are down in the southeast area of Minnesota, Rochester, Minnesota, September 20th, 12 noon until 7. We're going to have a salsa de soul. It's a very, very popular band, a musical group that is amazing. Mariachis and lots of food vendors. And if anybody's willing to come down to Southeast Minnesota, Rochester, September 20th, you're welcome.
Thank you, Marian. Anyone else? Any announcements? Any questions?
Hi, this is Heidi Carlson from MDH, and I'll put a link in the chat, but I just want to put a plug in for Healthcare Homes webinars. We have an upcoming webinar on Wednesday, September 24th from noon to 1 on supporting patients with opioid use disorder. So I'll put a link in the chat for that, and that's free and open to anybody who wants to attend that.
Thank you, Heidi. Are there other announcements, questions? Well, on behalf of the Alliance and on behalf of MDH as well, I'd like to thank all of you for participating. We lost a few, but I think today we had a pretty good turnout given the information that we were sharing is due for an update. So I'm glad that we were able to spend the time updating folks. And if you have any questions about anything, as Laura mentioned, you can reach out to anyone at the Alliance, or you can reach out to Laura and Kristen for information or to simplify the logic model. We certainly do want folks to use that. So we will give some time back to people today on Friday and hope to see you in October. We are having a kind of impromptu Supervisor Roundtable, which you will receive invites and agenda for as well. So we hope to see you then too. Have a great day and thank you, everyone.
Thank you.
Thank you.
Bye-bye.
Bye.